The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, welcome to Aging Horizons. On today's show, we'll be talking again about Medicare and a lot of issues that affect you that are kind of new. First, we'll talk about Medicare. What is it? We'll be talking about Medicaid unwinding and how it affects Medicare individuals. And we'll be talking about how you need to consider different aspects prior to retiring for your Medicare. And a lot more, so stay tuned.
Every generation produces heroes. Men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Hi folks, welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. I'm your host, Brian Lamore. And I mentioned that we're talking about Medicare today, particularly in light of the Medicaid unwinding, how it'll affect seniors and Medicare recipients. But let's start at the top. We got a wonderful host with us. It's familiar to everybody. Janet Stellman, you're the SHIP Director for the state of Montana.
Hi, Brian.
And let's start at the basics. What is Medicare and how does it provide services to the people?
So Medicare is a federal health insurance program for people age 65 or older, or people who have been disabled according to Social Security for 24 months. So it is a health insurance. There are two different ways to get it. You can go with Medicare Part A, B, and pick up a D. So Medicare Part A is your hospital coverage. So anytime you had inpatient type stuff at the hospital, Part A would cover it. Most people have premium free Part A because we have worked 10 years or 40 quarters, so it's premium free for us. Medicare Part B is your doctor services. So every time you go to the doctor, Medicare pays for that. So that is about right around $174.90 per month that one would have to pay. And then prescription drug coverage, so that's Part D. So if you didn't have any other creditable coverage, meaning as good as or better than Medicare, you would need to pick up a Medicare Part D or a drug plan to pay for your prescriptions. So prior to 2004, Medicare didn't pay for prescriptions. So that started through the Medicare Modernization Act, and it evolved into what it is today. So the other way, and then also if you go that route, you can pick up what's called a Medigap or a Medicare supplement. It's an extra insurance policy. Traditional Medicare is 80-20 split. Medicare pays 20% or 80%, and the beneficiary pays 20% after deductibles and coinsurance. So in order to help pay that 20% and those deductibles that a beneficiary is responsible for, they may want to get into a Medigap or a Medicare supplement, which is through private health insurance companies, and it's just a supplement to Medicare to help pay that 20%. So you can either get the bare bones model, or you can go for the the Cadillac type model. So, and of course, one's gonna it's gonna be pricier the higher the more coverage you get. You don't have to take a Medigap or Medicare supplement, but a lot of people like to do that. So the other way to get Medicare is through Medicare Advantage plans. So that's these private companies that say to Medicare, we can take care of a beneficiary's Medicare benefits if you give us a pot of money. So Medicare gives them a pot of money, and they take care of all the A benefits, the B benefits, and the drug benefits usually. So, and sometimes you'll hear it as Medicare Part C. So that's the Medicare Advantage route. So it has to it has to pay everything that traditional Medicare pays, but it may pay it in a different way, and they may offer additional benefits. So instead of, with traditional Medicare, you went to the doctor, the bill was $100. After you'd met your deductible, you'd be paying $20. And Medicare would pay 80%. Under a Medicare Advantage plan, you might pay $5 every time you go to your preferred provider. So that's the thing with Medicare Advantage plans, is usually there's a network involved. So in order to get the best prices, you have to pick your provider, and you have to stay within your network to get the best prices. So one thing about the difference too is that with traditional Medicare over here, it's 80-20 split all the way through the year. But with a Medicare Advantage plan, they have maximum out of pocket. So once you reach a certain level, let's say you have a surgery and your portion of it was, maybe it was $100,000 surgery, you're only responsible for the maximum out of pocket, unless, as long as it was in network. So maybe your maximum out of pocket was $4,500. So you'd be responsible for $4,500 of that $100,000 hospital bill. And then you would be covered, the company would be paying the rest of the year. So,
well, now, Janet, this sounds a little bit complicated. Individuals become eligible when they're age 65. Certain people with disabilities, after 24 months, they can get it, so they could be much younger, technically. But what's important to know is that it is complicated, but we have people to help out. They're SHIP counselors, and they're throughout the state, and you coordinate with them, don't you?
Right. We have SHIP counselors across the state. They may not live in your county, but they cover your county. So they're usually located in your area agencies on aging, and we have 9-10 area agencies on aging around the state, and so there's a SHIP counselor in each one. You'll find them a lot of times in the community health centers. We're getting a lot more folks trained as SHIP counselors that work in those community health centers or in some of the hospitals, that they can help explain that, or at least get you referred to a SHIP counselor. So anywhere in the state, as long as you're calling on a Montana number, if you call that number on the screen, it will direct you to your local area agency on aging. If you're calling from a cell phone, I'm not sure where you're going to end up. You might end up with me. So, and then I'll give you the direct line to somebody in your community, because it's better that you can establish that relationship with somebody local in your community, and build that relationship so you know that you can trust them. The SHIP counselors are trained in everything Medicare, helping Medicare beneficiaries. So.
And what's important to know is they don't have anything on the shelf to sell you. They will assist you in making a decision as to what best meets your needs, because if you're younger, you may not have a lot of medical issues. If you're older, you might have a lot, and there are alternatives to these plans through the Medicare Part C program that might be a good choice for you. And for our viewers, these people are really nice, they're friendly, they're very confidential. They're not going to share your information. Medicare is a little bit confusing, and as you get older, sometimes many things are confusing. It's good to have these advocates on your side, and they're generally local. You might even know some of them. So the number on the screen, call them or contact the website. We're going to talk a lot more about what's happening with Medicare in the state of Montana, so stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Today, class, we'll be discussing the term ombudsman, a word we borrowed from the Swedes and never gave back. Say you're a resident or you have a loved one in long-term care. Now, what do you do if you're not happy with the care and services you receive? You call your long-term care ombudsman, of course. Your ombudsman is available to support you and your rights. An advocate on your behalf could be the ticket. This is your home. If you have questions, the numbers right there below me have all the answers. Class dismissed.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and continuing our discussion about Medicare. And in this segment, we'll be talking about Medicaid unwinding with Janet Stellman, who's our SHIP director. And Janet, we've heard a lot about Medicaid unwinding. How does that affect our Medicare beneficiaries?
Right. So if anybody was on Medicaid when COVID first started, Medicaid or a Medicare savings program, during those 3 years of the public health emergency, they got to stay on their Medicaid or their Medicare savings program without having to do any paperwork or anything. So last year, when in May, I think it was, or March, they ended the public health emergency, and so they started doing renewals on people that were on Medicaid and Medicare savings programs. And so Montana actually should be done with that renewal process, but now they're starting on the yearly renewals. So in the last year, you may have been contacted to do some paperwork, or they tried to contact you, but a lot of people hadn't had access to, or had any communication with the Office of Public Assistance in those 3 years, you know, because their Medicaid just went on. And so a lot of people were getting calls from a lot of people who have lost their Medicaid benefits. Maybe they aged into Medicare during the time during the public health emergency. And so when they got the renewal, they were no longer eligible for the Medicaid they were on because of aging into Medicare. And then also those folks that didn't perhaps get their paperwork back in time, or didn't get the mail that told them they needed to do this. So we're seeing that people have lost their Medicaid and their Medicare savings program. So we just want to let folks know that they can reach out to SHIP counselors, and we will try to help them get back onto benefits if they're eligible. We'll help them apply and talk to them about that. So give us a call, and we really want to help you get your insurance, or your coverage back. So
So for about 3 years during the pandemic, individuals maybe became eligible for Medicaid, and it may have continued to help out Medicare. It became eligible. Well, maybe they were on Medicaid and they helped pay for their Medicare coverage, and then through the unwinding, they may have missed something and it went awry.
Right.
And you don't want to go to the doctor in need of services and say, I've got Medicare or Medicaid, and they look and they say, no, you don't.
Right.
You want to address this ahead of time. About 130,000 people have been removed from those roles. So if anybody's been receiving those benefits, give your Medicare person, SHIP counselor, a call, because you're kind of crossing over with the Medicaid now to help. I mean, it's got to be confusing.
Well, you're not going to be able to call us and ask us what's going on with your Medicaid, because we're not going to be able to know that. So that would go to the Public Assistance Hotline. However, if you know that you need help, either applying or getting back on that program, we can help you. We can't necessarily without your authorization form, we cannot work with the Office of Public Assistance unless we have the authorization form.
Oh, okay.
So if you're calling us trying to find out what happened to your program or your Medicaid, we're not going to be able to tell you. We can kind of make a guess, but we can definitely help you apply for that again. So
apply before you need it.
Yes.
Verify that you still have it. So that some of the individuals are on Medicare, and it jeopardized some of their helping programs, right? Is what we're saying now. And tell us about the helping programs and how that changed with the Medicaid unwinding and how that got affected.
Okay, well, one of the helping programs that we're going to talk about next segment, but is the Medicare Savings Program, and that's at Medicare. It's administered through the Medicaid office or the Public Assistance Office, and it's a program to pay your Medicare premium. So that $174.90 per month for your Part B premium. It's a program that if you're eligible, you have your income and resources are under a certain amount, that you could qualify for this program, and it would help pay for that Part B premium. And depending on what level of assistance you're eligible for, if you have a Part A premium, which is $505 a month, most of us don't have to pay that because we have 10 years work or 40 work quarters, so we don't have to pay that, but there are people out there that do. And so if you qualify for I call it the Cadillac model of the Medicare savings programs, it'll pay that $505 a month for you, which is huge. So so that was one of the programs that may have been affected during this unwinding, and so we want to make sure that we help everybody get back on that's possibly eligible if they lost it. So
if an individual lost the supplemental programs during the unwinding and they have not had coverage, can they, going through a SHIP person, reestablish that coverage immediately, or is there a waiting period to get back on?
Well, we're going to help them reapply for these programs. For the Medicare Savings Program, if it's a new application, they have 45 days to make a determination, and we know that they're really busy, so sometimes it's going past that 45 days. But we can help them to reapply. And that's really, hopefully everybody that comes through our door, we're looking at whether they're eligible for a Medicare Savings Program or some of the other Medicare helping benefits. So,
and one-stop shopping is what we call it. You come in and there may be other programs that you could be eligible for, but you talk about Medicaid, Medicare, helping programs. It may sound a little complicated sometimes, but what's important, the number on the screen has individuals that are here to help you, and they'll help unwind that and get you back on, or get you on the right path if you meet age, income, eligibility, and variety of other things.
Right.
Now, we've covered a lot of ground here, ladies and gentlemen, and what's important to know is that we have SHIP counselors that can help you. And in our next segment, we're going to talk about some helping programs to help cover the cost of Medicare for you. These are great programs. They help a lot of people, and maybe you're eligible for it despite of the unwinding, so stay tuned. Perhaps our regular viewers have noticed that we've been missing a host for the last several months. In July, our favorite person, Kimmy Everman, unexpectedly passed away, and we'd like to take a few moments now to share some memories that we have of her.
For many of us, watching Aging Horizons with Kimmy as the host was like talking to a friend, and for Kimmy, that's exactly what it was. She cared about all of the viewers of Montana on Aging Horizons as if they were her personal friends. She wanted each of us to live the best possible life and connect to as many services as possible. She had no greater joy in life than connecting advocates to others that could help Montanans across the state with problems that they maybe didn't know as much about. Losing Kimmy was a great loss to the state of Montana, but the work that she did will live on in the hearts and minds and Rolodexes of so many of us at the state.
So working with Kimmy was always a very fun experience for me. She lit up a room with her smile, and I loved her giggle. She had this giggle That was the cutest, most happiest spreading of joy that I could describe. She also was very passionate about her work, about helping veterans, and about her dog Sophie.
Kimmy's been my friend, my coworker, and my mentor for over 20 years. She has taught me so much about not only Medicare, but working with people. She had a great sense of compassion and love, especially for veterans, animals, and the underdog. She loved working with seniors and people with disabilities. That was her heart. She will be greatly missed.
Aging Horizons have been on the air for over 30 years, and I've had the pleasure of working with these wonderful ladies and everybody in senior long-term care that length of time, including Kimmy Everman. And whenever we got done with the show, I just loved her laughter, which everybody's commented here. It was like we're getting away with something. Isn't this fun? And I will sincerely miss both that and her.
Welcome back to Aging Horizons. I'm your host, Brian Lamore. We're continuing a discussion about Medicare. Now, we've covered the ABCDs of it, some of the Medicare unwinding and your eligibility for that and who can help you out. But now, Janet, let's talk about helping programs. Montana has a number of programs that can help an individual pay for their Medicare premiums based on different qualifying things. What are these programs and how are they qualifying individual?
Right, so I love to talk about this every time I come on. Yeah. They're my favorite programs. So the first one is Extra Help or Low Income Subsidy. That is to help with your prescription drug plan. So with Medicare Part D, you're going to have a portion of the cost all the way through the different stages. But if you qualify for the Extra Help or the Low Income Subsidy, they say it's about a $5,000 per year savings for a beneficiary. But having worked in this program, we know it's hundreds of thousands sometimes. Really? So what it does is it helps pay those prescriptions. So instead of paying somebody who's not on Extra Help or low income subsidy, as it's called, may have to pay 25% of the cost of the drugs. So we know that 25% of $3,000 is still quite a bit, or however, because prescriptions can be so high. And so somebody on low income subsidy or Extra Help, they're only paying anywhere from $1 to $11 right in there per prescription. So that's huge, especially if they're on a really expensive medication. So any drug that is on your formulary, and as long as you qualify for low income subsidy, you're paying a co-payment instead of that 25%. So that's huge. So where you go to apply for, if you're computer savvy, you can go to socialsecurity.gov and apply. And it's a real quick 2-page application, or you can contact SHIP and we can help you apply for that too. So, but it's very beneficial and it saves people a lot of money. A lot of times it is a matter of, am I going to be able to take my meds or not? So that's a great program. The second program we touched on a little bit last segment is the Medicare Savings Program. And that's the program to help you pay for that Part A premium, Part B premium, and any co-insurance and deductibles. So there are 3 different levels in the Medicare Savings Program. Those with the lowest income and resources may qualify for the QIMBY program, and that's the program that will pay their Medicare Part A premium, that $505 a month if they don't have enough work orders. It'll pay that $174.90 for their Medicare Part B premium, and deductibles and co-insurance. So like Part B, every year you have it, like I think it's like $205 a year deductible that you have to meet first before Medicare will pay anything. But with being on this program, QIMBY program, it'll pay that deductible. And remember I said Medicare's 80-20 split, right? So Medicare pays 80 and the beneficiary pays 20 after meeting the deductibles. Well, if somebody's on the QMB program, it acts as a supplement to Medicare and it pays that 20%. So that is the Cadillac model. The other models, the other 2 programs are SlimB and QI. They have a little bit higher income income guidelines. So if somebody's eligible for those programs, it's only going to pay their Medicare B premium, so that $174.90 or whatever it is, but still very beneficial. They say the average cost of that is the average benefit for an individual is about $2,000 a year, so that's helpful. You know, $174.90 back on somebody's check that only gets $1,200 or $1,300. That's big. So that's great. And then the last program I want to talk about is Big Sky RX. It was a program that came about under the Schweitzer administration. It's funded on tobacco tax. Every year they get a pot of money and they help those people that are within the income guidelines who don't qualify for the prescription drug help under the low income subsidy or extra help program. They can if their income's under a certain amount, they could qualify for Big Sky RX. Big Sky RX doesn't look at the resources or the assets, meaning the things you own. So that may disqualify people from these other helping programs. And so what it does is it just pays your Medicare D, your drug benefit premium, up to like $41 a month. So, and they can usually pay that company directly, that drug company directly, or they can reimburse you in your bank account. So
once you've paid it.
Yes. Okay. And so that's a great program. And again, these are not handout programs, you know. These are just hand up. These help you, you know. And I train my counselors all across the state to, you know, when you have somebody in your office or on the phone, let's really screen them for these programs because they're so valuable, and just the money it can save them when they're already on such low income, you know, fixed income. So.
Yeah, well, let's talk a little more about our SHIP counselors, because it sounds a little complicated what you're talking about. You might be eligible for one of the programs, maybe not all, maybe all, and then Medicare, you know, it has some billing maybe issues, eligibility issues, but we have people to help you out.
Right.
They're the SHIP counselors.
Yep, and they're located in the area, most of them are in the area agencies on aging across the state. You call our hotline and it should get you to your current SHIP counselor or your area agency on aging. We also have some folks set up in the community health centers and the hospitals. So they are there to help you. They go through a 2.5-day training. Well, prior to that, they have to do 18 Medicare modules online that take about an hour each. And then we kind of go over some of that in training, and we learn about other things, and you know, so they are trained on Medicare issues and the helping program, so they can help, and they are just a great resource, and they care about their beneficiaries, and they go extra mile for them.
And what's important is they're knowledgeable. They don't sell you anything.
Confidential.
They help you make the proper decision for your situation.
Yep, we don't direct them.
Right. Well, thank you, Janet, for being on the show and your show and helping everybody out. And for our viewers, you know, I think it's important to understand there's people here to help you with your Medicare billing, eligibility, and possibly other programs that are there to help you out. We see a lot of issues coming up in the news occasionally about Medicare and Medicaid, but we have SHIP counselors to help you. Give them a call. They want to hear from you. And thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.